and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. In early July, Professor Dr Adeeba Kamarulzaman was appointed President of the International AIDS Society. The IAS is the world's largest association of HIV professionals working to reduce the impact of AIDS. It's got more than 12,000 members across 170 countries worldwide. Dr. Adeeba is also the Vice President of the Malaysian AIDS Council. She's also the Dean of the Faculty of Medicine at University of Malaya. We are delighted to welcome her on the show tonight. Good evening, Dr. Adeeba. Welcome to the show. It's good to have you on. First off, congratulations on the appointment. You must be so happy. Now,
I don't know.
you're the first Asian, yes, the first Asian president of the society, also the first from a Muslim majority country to be appointed president of IAS. I'm wondering, Dr. Adeeba, will this be significant in the way you plan to lead IAS during your tenure?
Yes, certainly. I think, you know, one of my hopes during my tenure is to really put a spotlight on the HIV epidemic in Asia and the Pacific. You know, Asia has 60% of the population, and although in terms of the burden of the HIV epidemic, of course, we're nowhere near that of sub-Saharan Africa, and rightly so. For the last 4 decades, the focus has been in you know, the global response has been, the focus has been in sub-Saharan Africa. But if you look at what's happening in Asia Pacific, it's very worrying. I think in terms of the indices and targets that we have set ourselves to end AIDS, we're definitely lagging behind countries that are even less developed than us. So that's my hope to
Adeeba, can I ask you, you know, for those of us who don't know what the IAS is this an organization with policy heft? Does it have the year of governments? Can it change the way things are done? Or is it an association of experts who are telling us what ought to be done, but are essentially powerless?
So, okay, so no, it is not like a UN organization like the WHO or UNAIDS. UNAIDS is a joint UN organization of all the other UN organizations, and its focus is purely on HIV/AIDS. And of course, being a UN organization, it has slightly different clouds. But what I'd like to think is the IAS brings the voice of HIV professionals and researchers and community people and people living with HIV. And what we do every year that's hugely important is that we host the largest scientific conference on HIV/AIDS. And for instance, just last week, we were supposed to host 20,000 people in San Francisco and Oakland to bring together scientists, policymakers, community workers to discuss the latest in HIV science and HIV programs. Because of COVID, we had to, you know, in less than 3 months, turned it all virtual, and I must say, you know, it was relative, you know, it was quite successful given that, you know, it was done at a very short notice. But what it does is, by having this large gathering of people, we put HIV on the map. We use that platform to advocate and to, you know, constantly put HIV out there for you know, for the world to see. We had a massive media coverage on you know, the latest findings on the relationship between HIV and COVID, and how the COVID pandemic has set back the HIV response, not just HIV, but TB and malaria as well. So, yeah, so we may not have a direct policy-making ability, but certainly by convening a large gathering of scientists and policymakers. Many good things happen at the AIDS conferences.
Okay. Well, a little earlier, Dr. Adeeba, you mentioned that the response to the AIDS response, there are targets to end AIDS by 2020. I wonder whether you could touch a little bit more on the 90-90-90 goals, referring to the target to end AIDS by 2020, by this year, in fact.
By 2030, really, target to end AIDS by
2030.
2030. Yeah. So what it is, and I think, a lot of people are still not aware that we have very good treatment available for HIV now. And by taking antiretroviral treatment, someone living with HIV can essentially live a normal life, especially if they are diagnosed early. That's number one. And number two, by taking effective treatment, we can really bring the level of virus down to what we call undetectable. And by doing this, the person who's HIV infected is almost unlikely to pass that virus on to their sexual partners, to their child, to someone they're sharing a needle with. So this is what is known as the U equals U, undetectable equals untransmittable. So the 90-90-90 refers to this, that in order to bring an end to AIDS, we must test, or 90% of people who are living with HIV must know that they're HIV positive. And the only way you can do that is by testing. So 90% of those who are HIV positive must be tested. Out of those who are HIV positive, 90% must be on treatment. And of those who are on treatment, 90% should have undetectable viral levels. So that's what the 90-90-90 refers to. When this was first mooted, everyone thought these were, very lofty goals that's going to be difficult to reach. But, countries around us like Cambodia, Thailand, and like I said, some countries in Africa that are much less developed than us have reached those 90-90-90 goals, namely Swaziland, Zambia, Botswana.
Wow.
What's stopping us from reaching those goals? I'm assuming we haven't.
Yeah. So, every country is supposed to sign on to this. What's difficult for Malaysia is, I think, and many countries in the region, is we have infections amongst what we call key populations. So amongst people who use drugs, amongst men who have sex with men, amongst sex workers and transgender. All these groups of people that society marginalized, criminalized. And so by having, criminalization and huge stigma and discrimination associated to it, people who belong to these at-risk categories are not coming forward to be tested. So I think that's the biggest barrier that we face.
Okay, well, that's very interesting. Let's continue this conversation. There's a lot to unpack there, but we're going to take a quick break first. So we'll have you stay on the line, Dr. Adeeba, for a few minutes, and we'll be back on Consider This, so stay tuned. Hi, if you've just joined us, you're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. We're speaking to Dr. Adeeba Kamarulzaman, who is the newly appointed president of the International AIDS Society. Dr. Adeeba, I want to talk a little bit about something you mentioned just before the break about being undetectable, right? So I know one of the one of the taglines is "Talk Undetectable, Talk PrEP." Can you tell us a little bit more about that?
Okay, so PrEP is also something that, has become a key tool to end AIDS. What it is that for people who are HIV negative, you can take this pill called Truvada on a daily basis, and it has been shown to effectively prevent you from being infected with HIV. Now, one of the, and this has been shown in basically all risk groups, from MSM to people who inject drugs to, heterosexual infections. One of the exciting things that came out of the recent AIDS 2020 conference is, and of course, taking a pill every day, like the oral contraceptive pill, one may not be so adherent or compliant to it, or you just get tired of taking it, right? So obviously, if you don't take it, you're not going to protect yourself. So one of the latest signs that came out of the recent conference was there are injectable drugs or implantable drugs, a bit like, again, the oral contraceptive pill that you can inject in the case of injection or implant. And so these long-acting drugs will reduce the need to be taking pills every day. So, and there's good results showing that it is superior to the Truvada, obviously, because you don't need to rely on someone taking the pill every day.
I do want to ask you, though, when we talk about drugs, and I think in the coronavirus COVID-19 issue, we're talking about the possibilities of vaccines and such. Cost is always an issue. Distribution, access is an issue. You talked earlier, Adeeba, about key communities who, because they're stigmatized, are not volunteering to be tested. Do we have the same problem? I mean, are those key communities also then, those who should be taking PrEP as a prophylaxis, are they able to access those drugs? Do they even know about them?
Yes, so they are, but sadly, it's not as widely available. I mean, it is the drug. First of all, let me address the cost. So in Malaysia, Truvada is available at less than 100 ringgit a month. So it's affordable. It would be great if it's available free of charge from Ministry of Health, of course. And secondly, knowledge about it is not as good, as widespread as it should be, and we have a lot more work to do in that area. But one of the exciting things that we at the Malaysian AIDS Council and the Malaysian AIDS Foundation hope to launch very soon is HIV self-testing. So it's just like going to Shopee or Lazada. You go to the internet and order the HIV test. We will send it to you in the post. You do the test and you take the results and you send it back by this website. And we will then link you, if you're HIV negative, to a PrEP site around the country. If you're HIV positive, we'll link you to a clinic or a doctor. And obviously, there are also counseling lines that will be available for the person.
Right. I do want to ask you, though, I mean, Adeeba, you say there isn't enough awareness. Is that because, and this is a long-standing criticism, is that the government, because of cultural or social or political sensitivities, outsourced public awareness to NGOs because it doesn't want to be associated with these marginal or at-risk communities? Is that the problem? They just won't put this information in schools where it would have the greatest effect. And is that what's happening? Is government afraid to be associated with this?
Yeah, I think if you call a spade, that's what's happening, and that it's you put it nicely, that it's been outsourced for to ask the NGOs to do it. And of course, we do not have the same level or the same amount of reach nor resource, right? I mean, we saw the awareness campaign and the education on COVID. It was very beautifully done on Astro, on RTM and all that. And I think that was a very, very key aspect of our success in responding to the COVID epidemic because, Malaysians were adequately educated and well educated through all the channels. Everywhere you went, you saw, they were on TV, on billboards and all that. Yes, that's the big difference with HIV/AIDS.
Well, I think, Dr. Adeeba, I think one of the things that we often forget is that whenever we're responding to public health issues or diseases, the response is not just a medical response, but it's also a social response, especially one, for instance, like HIV and AIDS. How are you incorporating that? I know you are a medical doctor by training and you're looking at the public health response, but how are you incorporating the social element of dealing with this disease?
So that's why, I work and have always worked very, very closely, and that's the beauty of going back to the International AIDS Society, that we're not just a society of doctors and researchers, but also community workers, and that's the ethos of the HIV world, actually, that, A, no one's left behind, and B, nothing about us without us, kind of thing. We have a lot of slogans. So by working with the Malaysian AIDS Council and its partner NGOs, we go directly to the ground. So, there is there's still a lot to be done, certainly, and the social aspect is the other thing that we, are advocating for. For instance, the decriminalization of drug use and decriminalization of sexual preference.
So will it take legal reform, legal changes to also ensure that the social response changes?
Ideally, yes.
Okay.
Definitely.
All right. Okay, Dr. Adeeba, we're going to take another quick break, but let's come back and tackle that difficult topic after this on Consider This. Stay tuned. Thank you for staying with Sharaad and I on Consider This. We're speaking tonight to Dr. Adeeba Kamarulzaman, who is the newly appointed president of the International AIDS Society, which is headquartered in Geneva, Switzerland. Now, Dr. Adeeba, I'm wondering, you alluded to this earlier, but if you could pick up and elaborate a little bit about the challenges of HIV and COVID being linked. So you talked a bit about how COVID has set back the HIV response. What did you mean by that?
So in many respects, of course, firstly, just the very need to do lockdowns meant that people couldn't come forward to go and get their medications. There was this whole problem with supply chain across the world, and drugs such as antiretroviral drugs and even tools like clean needles and syringes, all that got disrupted. So that's number one. Number two, funding that would have otherwise been, for HIV/AIDS might have been diverted to COVID response. For instance, the Gates Foundation have put in a lot of funding to COVID-19, and traditionally they're one of the biggest funders for the global AIDS response. Number three, a lot of the doctors and nurses and healthcare professionals actually around the world, including myself, who were working on HIV/AIDS, were then taken away to instead provide services, rightly so, for COVID-19 patients. So the longer the COVID-19 pandemic continues, the longer all these resources, whether it's human or financial resource or just, plain disruption of the supply chain, will impact on other diseases. Not just HIV/AIDS, but studies have also been done to show that it will increase deaths from HIV, TB, as well as malaria.
But there's also this very interesting comparison that's made by some writers drawing our attention to the early days of the AIDS epidemic and saying that much of the conversation also revolved around the, the discovery of a vaccine. And today we talk about it, Donald Trump kind of maybe prematurely, said that, we would find it by fall of this year and so on and so forth. Is there something mistaken in our hopes that a vaccine is the silver bullet? This will be the way we will get ourselves out of this pandemic.
Yeah. So I'm one of those conservative pundits who would, it would be fantastic if we had a COVID-19 vaccine SARS-CoV-2 vaccine by September, as some are saying. But the path of successful vaccines have been strewn with, failures and setbacks. So, it's very, very optimistic in my mind. And even if we get it, even if, brilliant scientists who are working on it 24 hours a day, get something out by September, again, the whole logistics, the whole purchasing, all of that, how are we going to get it to, 30 million people in Malaysia fast enough?
And if we were to draw on the lessons that we've learned about distributing drugs to those who are HIV positive or with AIDS, what can we learn about ensuring that there is equitable access to therapeutics, to drugs, to a vaccine, should it ever come to be?
Very good question, Melisa. Very good question. I recall when I first treated patients in Malaysia back in 1997-98, when we finally had effective antiretroviral treatment. My patients then were paying 2,200 ringgit a month for antiretroviral therapy. Now, of course, they're given free of charge, but for newer drugs they still have to pay. So the world will need to do something about this in terms of ensuring that the price of vaccine is going to be affordable to each and every person on this planet.
I do want to ask you this.
Yes,
right. Sorry to interrupt you, but is there a distinction between these two diseases, as it were? Because when you think of HIV/AIDS, people often focus on marginal groups, on people who take high risk. Apart from somebody who's getting a blood transfusion, everybody else seems high risk, or it seems to be some sort of moral failing on their part. Whereas with the coronavirus, it's basically amoral. Everybody's getting it, potentially.
Everybody's at risk, yeah.
And does that change the dynamics of our response?
Yes, I think it does. And the other big difference is also in terms of the nature of the disease. With HIV, you've got that prolonged sort of silent period where, a lot of people don't even know that they're infected. And so that sense of urgency may not be so great. Whereas with COVID-19, you certainly know about it, disregarding the asymptomatic group. But if you do develop and have symptoms, then the ones that progress and have severe disease will do so very quickly. So I think those two things. One is the tempo of the clinical illness itself, and then, of course, princes and prime ministers and paupers are all at risk of this disease. So yes, it does bring a different dynamic. And then, of course, in the way it's infected, it's transmitted as well. So that sense of urgency is very, very much higher with COVID-19 pandemic than HIV.
Right. In the minute or so that we have left, Dr. Adeeba, I want to ask you what it would take for Malaysia to ensure that we reach our 90-90-90 goals, given the time frame that we have left. I know you talked a little bit about legal reform as being one of the key issues, but what else can we do? Because legal reform often works in a snail's pace.
Yeah. So I think resource is probably the most important thing. And, you know, one good thing about technology, although technology also increases the risk of someone getting infected through connectivity and easy access to, you know, whether it's drugs or whether it's to other sexual partners. But technology, I think, is also something that we can use to raise awareness, and also, as I indicated to you, in terms of this HIV self-testing, so people don't actually physically have to go to a clinic to be tested. So we really hope, and likewise with PrEP, you know, and well, PrEP is a bit difficult. It's a drug, so you need to see a doctor and all that. But I'm quietly optimistic that, you know, if we really scale up HIV self-testing using the internet, we can reach out to a lot of people who are at risk and channel them into either treatment or PrEP.
Dr. Adeeba, it's been such a pleasure speaking with you tonight. Thank you for taking the time to speak with us and sharing, and congratulations on your recent appointment. That's all the time we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off the evening.
Thank you so much for watching. Good night, folks.